So let's start. Welcome everybody. My name is Britta Holmberg. I'm speaking to you from a very rainy Stockholm today. And I will say a couple of words about who I am a bit later. We are very happy to present the report Impact of COVID-19 on privately run residential care institutions today. With this webinar. The webinar is part of a series of webinars from the Transforming Children's Care Collaborative Platform. We have a slide about that, if we can get that slide. Exactly. Thank you. So here you see the name of the platform, and for those of you who haven't signed up yet, please do so. It is an ambition to help us all to engage on a more strategic level, and all of us are needed in that work. So do sign up. Some housekeeping before we start. We will record the session. I think you've all seen that information. So the webinar will be published a bit later, and it will also be available or captured in French and Spanish. As I already said, do introduce yourself in the chat. And if you have questions already now, or if you get questions during the presentations, use the Q&A function, please. And also, if you see some questions somebody else have raised, you can also use a function meaning upvoting, meaning that you can also support that question, so to ensure that we see it. And we will have quite some time, we hope, at the end of the session to have a dialogue and Q&A session. If you have comments or reflection or want to share something with the group, do use the chat function. The program is quite straightforward. We will hear a presentation of the key findings of the report, and we will also get some information from the country level perspective from Thailand, and some reflections about how this report has helped in advocacy towards funders of residential care. So as I said, my name is Britta Holmberg. I'm the Deputy Secretary General and Program Director at World Childhood Foundation, an organization based in Sweden and founded with a mission to inspire, promote, and develop solutions to end child sexual exploitation, abuse, and violence. And reducing violence or reducing the use of institutional care and supporting family-based alternatives has been an important part of work since we were founded over 20 years ago. And that is because we know that the risk for violence and abuse increased drastically, both during the time a child is placed in an institution, but also afterwards. And that a safe, nurturing family environment can be a strong protective factor. I know you all know this already. But we at Charlie, we have close partnerships with organizations working to promote care reforms in many parts of the world. And we're, for example, supporting development of alternatives to residential care in Thailand and Cambodia. And through that work, during last year, quite early during the pandemic, we started hearing from our partners that orphanages in many countries were closing rapidly due to the pandemic, and we heard that children were being sent home without proper assessment and without knowledge about where they actually ended up, and without follow-up. And we were really concerned about what we heard. We can take the next slide, please. So in dialogue with Better Care Network and with funding from the Swedish Postcode Lottery, we decided to commission a research that we're presenting today. The main aim was to explore and understand how the very drastic measures that many countries introduced, school closures, social distancing, lockdowns, affected orphanages, but also to analyze if this, just like many other crises, would lead to more children being separated from their families. And we also wanted to understand if funding drops due to the absence of travelers and volunteers would lead to orphanages closing. Next slide, please. So we had many questions and concerns regarding how this would affect children in care and the way that the residential care centers were operating and their funding situations. And as we started to work on the study, next slide, we saw that this could actually be an opportunity to find new ways to engage with RCI directors and donors and volunteers. So now we have the final report with some really interesting and sometimes a bit surprising findings, I would say, and we would hear more about them in a minute. But first, I want to introduce the first speakers, the main and international advocacy. And I would say that both of these two presenters have made groundbreaking contributions to the way we today understand and address the negative impact of residential care. Rebecca's focus is on transitional residential care institutions and reducing drivers of institutionalization, including orphanage tourism, and foreign funding. Rebecca is the co-founder and co-chair of Rethink Orphanages Australia and the Australian Council for International Development Child Rights Community of Practice. And then we have Dr. Kate Fundor, an international child rights lawyer and academic at Griffith Law School in Australia. She is an internationally recognized expert on the intersections of child rights, institutionalization, and human trafficking. Kate works with governments, NGOs, and companies on their approaches and responses to orphanage tourism and trafficking. So we're super happy to have you both here today. So over to you, Kate and Rebecca.
Hello, everyone. Thank you for that very warm welcome, Britta. And I want to start actually by just acknowledging and saying a huge thank you to the World Childhood Foundation and ERIK's development, who really got behind this study that was conducted in partnership with the Law Future Centre, Better Care Network, and Connected. We were just so grateful to have that support from all of you, and it's just been a really great journey for us conducting this study. So I'm going to take you a little bit through why we did this study, who was involved, and then start to talk about some of the findings, and then Rebecca will pick up and finish the findings and talk about some of the plans and future plans for these RCIs and reflections. Catherine, if I can have the next slide, please. So Britta has actually covered this brilliantly already, but we conducted this study because we were really interested to see what happens when we have this kind of disruption that is occurring across the world that is somewhat of an equalizer in some respects when you think about it. You know, all privately funded residential care, we're experiencing this impact of COVID-19, albeit of course that governments have very different abilities to cope with such an interruption, but this pandemic was a bit of an equalizer. So what we were interested in is how are privately funded residential care institutions responding to COVID? How are they responding to government shutdown orders? How are they responding to the medical issues that are arising? What's happening in the day-to-day life of these private RCIs? Next slide, please. So to do this, we interviewed 21 different participants across 7 countries. And what was interesting about this is that we didn't just concentrate on countries where RCIs are located. And when I say RCIs, I'm assuming you all know I mean residential care institutions, sorry, bit of lingo. So we looked at not only where those residential care institutions were located, but also donor countries. And the donor countries were Australia and Sweden. And we interviewed 5 different organisations or participants from organisations in those donor countries. And then we looked at 5 countries where privately run residential care was still functioning. So those countries were Cambodia, Thailand, Myanmar, Kenya, and Nepal. And we conducted interviews in all of those countries. Now, the commonality between these RCIs was that they were all foreign funded and they all had a history of accepting volunteers and visitors. So that was kind of a baseline that we had. And one of the reasons for using that baseline was that we wanted to really look at and interrogate what was happening, particularly in relation to volunteering, orphanage volunteering. So you're going to hear a bit about our findings on that. And the other question we asked the participants when we first interviewed them was, how many of these organisations are foreign founded and how many were foreign run? And so you can see those figures there, that 12 of them were foreign founded, 6 of them were foreign run, and that has implications also for some of our findings. If you could just click the slide for me, thank you. So one of the questions we asked the interview participants was, why are you involved with residential care to start with, and maybe with this particular institution? We're interested in this because we're interested in the who of residential care. Who's involved? Why are they involved? The most interesting thing that emerged here was that 71.5% of our interviewees said that faith was a basis of their involvement or a major motivation for them. Now, I should be very clear here and say that interviewees weren't asked to just select one major motivation. So this doesn't add up to 100% if you've noticed. They could select multiple. So 71% that said faith, but the next highest figure was 29% of participants who said that they had had a past experience with orphanage tourism. So that meant that they had either volunteered in an orphanage or residential care institution before, or they'd visited one, they'd done a mission trip to one, or perhaps they'd worked in one. And for some, in fact, 19% of the participants, they had commenced involvement because they had been in care themselves. So they were actually care leavers, which is really quite an interesting statistic as well there. Can we skip to the next slide, please, Catherine? So that's kind of the why and the who. So I'm going to talk just a little bit now about what we found. And my 2 major factors here are on orphanage tourism and what happened and what we found in relation to orphanage tourism specifically. So next slide. So we've got a few figures here and we've got a lovely pie chart. I think, like I already said, one of our foundations was that we were looking specifically at RCIs that had facilitated orphanage tourism, visiting or volunteering previously. So of those, 95% had actually facilitated what we call international orphanage tourism, which is international visitors and volunteers coming through. And 5% of them were not allowing international volunteers and visitors, but were allowing local volunteers and visitors. And you can see roughly half of them accepted both. It's an important distinction. 45% of them, when we asked, this is pre-COVID, are you reliant, or were you reliant pre-COVID on orphanage tourism for funding? 45% of them said, yes, it's integral to our fundraising. But when you look at that little pie chart there, and I'm not sure how well you can see it, but I'll kind of break it down for you a little bit there. The biggest benefit, when we asked the interviewees about what the benefit of accepting volunteers and visitors is, the biggest benefit they identified was that they provided fundraising support. And that's very closely followed, you can see there by the variations of blue, by involvement in in-kind donations, financial donations, and very importantly, long-term funding. If you have a look at the small slices of blue there, they are labour, 10%, and volunteering and visiting fees, 10%. So a very pre-COVID, a very small number of organisations were saying that volunteering and visiting benefits involved labour or caregiving, which is interesting because when we look at on the internet or when you're in one of these countries and you come across an advertisement to volunteer or visit in an RCI, often they're predicated on the caregiving needs of the institution, and the institution saying we need, labour, volunteer labour, to assist in meeting the children's emotional needs, which there's a whole nother discussion about, but also just to assist us with, keeping labour costs low, etc. So it's really interesting for us to note, pre-COVID, they were saying only 10% of them were saying it's a benefit. The labour is a benefit. If you can flip to the next slide for me, please, Catherine. This is what we found after the cessation of orphanage tourism. So once orphanage tourism was closed off from these RCIs, mostly due to border shutdowns, lockdown orders, of course, all of those sorts of public orders that were made by governments and mandates that were made by governments to, preclude movement of people, essentially. What we see here is a very different response. So where previously 45% of those RCIs were saying, yes, volunteering and volunteering and visiting is integral to our fundraising. Here we note that 81% of them are stating the primary benefit of volunteers and visitors with fundraising. And this is just because we asked the question in a slightly different manner. We said to them in the pre-COVID, was volunteering and visiting, what was the major benefit of volunteering and visiting? And of course, they came back with the response of fundraising support, but not in these figures. That was 27% here. When we asked them, what's the major impact of orphanage tourism ceasing? 81% of them say it has a huge impact on our fundraising. So that's very interesting. And in 100% of that 81 cases, all of those participants said orphanage tourism was integral to their funding model. So we're seeing a real difference between the pre-COVID and the post-COVID there. The other interesting thing here is that reflection on volunteer labour. Now, 80% of them said that volunteers were involved in running activities pre-COVID for the children. Only 5% of them listed that as any form of benefit for the children. So even though 80% of them are saying, yes, that's what's happening, there's only 5% of them saying, well, it's actually a good thing. And 19% of them noted that the cessation of orphanage tourism had any impact on those activities. So again, not a critical link that we're seeing there between volunteer labour and caregiving or children's activities. And if you notice down the bottom in the right-hand box, it actually says that 19% of the RCIs noted positive impacts due to the cessation of orphanage tourism on the children and organisation. And that's interesting because we heard some of the participants saying that actually the children were behaving better. The behaviour was more settled with consistent caregiving from staff. And it's something that Rebecca is going to pick up again on later. The last thing I'd like to say just about this slide is that we've said there, one of the findings is that 81% of RCIs reported that they would resume orphanage tourism. 81%, even though the vast majority had said it's not actually providing any benefit in terms of labour. So there's a very clear link here to the fundraising aspect. And only 9.5% said that they wouldn't be resuming. 11 to 12% said they do so in a more restricted manner. But just that reflection on how little material or how little benefit to the children and labour and staff volunteering seem to bring, and yet the ample reward in terms of fundraising. I think that's a really critical reflection. And I'm going to just hand this over to Rebecca to talk more on the further reflections from the report. Thanks, Vic.
Thanks, Kate. We can go to the next slide, please. That'd be great. So one of the things that we looked at in the study was the impact of the various public health, measures, restrictions and directives on the number of children who were in the residential care facilities throughout that period of time, particularly during lockdowns. And what we found is that the experience of different RCIs was quite different, but that in countries where there were both public health and pre-existing deinstitutionalisation directives, those countries experienced the strongest influence on children's movement. And in particular, where there were existing directives to return children to families, and that there were also travel restrictions that prevented otherwise planned visits or reintegration. So 76.2% of respondents told us that the number of children that they had in care did decrease from the onset of the pandemic to the point in time when we did the interviewing. 19% said that it was static, and 5% indicated that they had an increase in the number of children in care. But what was also interesting is that COVID disrupted in organisations' plans to recruit new children or admit new children, and 19% of participants noted that that was the case for them. For the 76% of respondents who noted a decrease, only half of them said that this was because of pandemic-related factors, and most of them were attributing it to government public health directives. And the other 38% said that the decrease was attributed to the pre-existing reintegration plans and processes and just normal family visits that were already part and parcel of how they operate. Most of the participants indicated that they planned for the children to return to the institution post the lockdown or when the schools reopened. And only 33% told us that they expected some of the children to remain permanently with their families or to be classified as permanently reintegrated, even if in the interim the way that they went home was under a lockdown order per se, and so it wasn't necessarily a planned reintegration. If we could go to the next slide, please. We also looked at the impacts on education, and this was probably one of the strongest themes that came out in the study. And over 2/3 of participants said that COVID had a negative impact on children's education. And this was attributed to a number of things, not just because of the widespread school closure, but also participants noted and emphasised that many of the institutions placed a very high value on education, and for some of them it was the primary reason why children were admitted. And of 95% of the respondents who reported that there were school closures, half of them said that the children in their care transitioned to online learning, but 60% said that respondents said that online learning was not available for all of the children in their care. Most typically, older children's education was prioritised above younger children's, and this was because of a range of factors, including limitations to the number of devices they had access to, insufficient staff numbers to supervise children doing online learning, and a lack of online classes for younger children, particularly primary age children. In the case of the remaining 50% of respondents who did not indicate that they had a transition to online learning, 70% said that they didn't have any access to education for the children in their care during that lockdown period. And the remaining 30% mentioned various other on-site educational opportunities. Some of them it was television programs, radio programs, or on-site tutoring. And whilst 2/3 of the participants mentioned a negative impact on children's education, 28.8% also noted some positive impacts. And this was mainly because of the introduction of vocational education for children who are on site in lieu of having their formal schooling. So some of them introduced agriculture or farms, things like that, that the children could become involved in, and other income generating activities that were run by the institutions. Next slide, please. Another thing that we looked at was the impact on funding. And 81% of respondents said that COVID had impacted their funding, and this was a concern to half of the participants. So 47.6% of participants had a decrease in their donor funding, and 38% experienced a loss of revenue from income generating activities. Now, some of the funding streams appeared to be more vulnerable than others, and the most immediate effects seemed to be felt by those that had income-generating activities, and where those activities had to immediately cease because of the lockdown and the restrictions. Funding models that were dependent on one-off donations were also more vulnerable than funding models that relied on regular giving or regular donors. So respondents who raised money through events, through speaking engagements, through orphanage volunteering and visiting were particularly hard hit by the pandemic. And those who raised money from individual donors who gave regularly seemed to be less impacted. And it seemed to be that their long-standing relationships that they had with these donors acted to protect these income streams for them. 78% of the respondents expressed concern about the loss of funding from volunteers and visitors. And what was interesting in their comments is that it indicated that they weren't as concerned about the loss of volunteering fees or the direct donations made by volunteers whilst they were visiting. It was the loss of the funding that past volunteers raised when they went back home and conducted fundraising activities amongst their family and friends. And so essentially what we saw was that COVID seemed to have disrupted their ability to recruit this continuous stream of fundraisers who were activated by their volunteering experience. And it was also interesting to note that respondents who were most concerned about the impact of COVID on their funding were those that didn't hold the fundraising role. So we had directors who were also the primary fundraisers, and they expressed a lot less concern when compared with directors who did not hold the fundraising role for their institution, who had a partner overseas in most cases who was responsible for that fundraising. And their comments indicated that it was almost like a feeling of being powerless and not able to directly relate to or communicate with the individual donors, and therefore not as much ability to flex or to pivot or to adapt in any way. And so they felt a little bit more fatalistic almost about their ability to rectify any decreases in funding. And so in response to that, many of the participants indicated a desire to reduce their vulnerability, their dependence on foreign donations because that funding stream appeared more vulnerable. The next slide, please. In terms of how participants adapted because of the financial realities of COVID, there were different strategies that were mentioned by different respondents. And the most common was reducing their expenditure on food, supplies, and utilities and things that they considered non-essential. And some respondents also mentioned that they had to reduce staff costs, which included reducing the salaries of staff as well as reducing staff levels. And others took to social media and increased their presence on social media to try to attract new sponsors and donors in a different way. Some tapped into reserves that they had, and some increased their engagement with local income generating activities. 14% said that they reduced or suspended new admissions of children into the institution, specifically as a way of cutting back their costs. Some respondents, particularly in Thailand, and Gift might speak more to this in a moment, looked more towards domestic solutions to offset that deficit of international funding. And this included increasing their engagement with local visitors and volunteers, and also asking for donations from care leavers, who I remember one of the participants in particular referred to as their alumni. The next slide, please. We also saw in the participants' eyes what they considered the impacts on children's care. And so this isn't really a study of exactly what the impacts were, but more the perspectives of the participants regarding the impacts. And it really focused more on the impact on their operations and the ripple effect of that on the children's care. So 71.4% of cases, the caregiving staff had to self-isolate in the institution with the children, often for extended periods of time, ranging from 1 to 3 months. And at some point then, some institutions would switch their staff and have another staff or staff persons come in to take over the care of the children again for an extended period of time. Interestingly, 23.8% of these respondents noted that this had a positive impact on the children's attachment and the relationship with the caregiving staff, and on the children's behaviour, as Kate also mentioned, with respect to the cessation of having orphanage volunteers coming in and out. And they attributed that settling of behaviours amongst the children to the improved consistency of caregiving, as the staff were no longer working shifts and coming and going, but were with the children 24/7. But a lot of the respondents also said that their staff had to take on increasing responsibilities, including for children's education. And so this became a significant source of stress for the staff as well. And 42.9% said that that had an adverse impact on children and was a cause of tension in some cases between children and staff. Next slide, please. So the pandemic had varying impacts on the residential care institution's ability or willingness to facilitate family contact and reintegration of children. So 61.9% said that family visits continued in some shape throughout the pandemic. 19% said that children who regularly visited families pre-COVID were sent home to self-isolate with their families instead of doing so in the institutions. Just under 10% said that they allowed children who were not permitted to visit their families pre-COVID to return during the pandemic to go through that lockdown period. And 23.8% said that normal family visits were suspended because of travel restrictions. And 14% recognised that this was the most significant source of stress for the children in their care. Of the 13 that said that children had returned home during the pandemic, only one reported that there were any serious child protection concerns. 38.5% noted wellbeing concerns, and this was often related to weight gain or weight loss, or children's inability to exercise because of lockdown restrictions and things like that. 53.8% of participants said that they had no concerns about the children's safety or well-being, even in cases where the return to family was unplanned and there was little support or preparation. 61.9% said that children had been reintegrated throughout the pandemic and were likely to be considered permanently so after they'd been on a home visit or spent a period of time self-isolating with their families. Reintegration was planned in the case of 38.5% of respondents and unplanned in the other 53.8%. And whether the children received support during periods that they were sent home or whether they were reintegrated was entirely predicated on whether or not the institution already had a reintegration program pre-pandemic. Those that did offered support to the children and continued to provide that for the period of time that they remained home or post-reintegration. Those that did not didn't generally initiate that return to family and didn't necessarily see it favourably, and they didn't offer any support to those children. So that was a really interesting finding to see the influence of pre-existing reintegration programs on children's experience of family contact and reintegration throughout the pandemic as well. Next slide, please. In terms of reflections on the future, so a lot of what we were trying to understand is not just what's happening, but how is this causing directors of residential care centres and donors of residential care centres to think about what they might do to adapt in the future, or whether it's affecting the way they're thinking about their models of care or models of funding in the future. Most participants, over 90%, said that it had catalysed reflection for them and that they were considering some changes. Over half were considering changes to aspects of their services or their programs, but for 19% of respondents, these changes were quite limited and didn't really reach the level of considering changes to the model of care. For another third of participants, it did, and it was involved considering changes to their model of care, including the prospect of transitioning or of closing down the residential care facility. For 14.3% of participants who weren't considering a change to the model, they were considering imposing greater restrictions on the use of residential care, including the admission of children and trying to limit the amount of time children spend in the institution. Just under a third of respondents reflected on the vulnerability of their funding model, and they expressed an intention to reduce their reliance on donor funding and shifting more towards what they saw as self-sustaining models of funding their services. Only 2 or nearly just under 10% of participants were considering changes to both the model and to the way that they were funding their services. The next slide, please. Just a few final thoughts to share with you in terms of what really came out of the study. It did seem to us that COVID had caused some stakeholders to personally experience and confront some of the evidence that we generally know about what is driving this shift away from institutional care in a way that perhaps the evidence as documented pre-COVID hadn't necessarily reached them or penetrated. And this includes evidence related to attachment theory, to the lack of life skills that is commonly evidenced amongst children growing up in care, and the importance of families. Also, family resilience. They seem to recognise families were more resilient than they perhaps had otherwise thought them to be, and the feasibility of family-based care. So in some cases, respondents were quite surprised that families were able to cope with resuming care of their children despite it happening in the midst of a global pandemic. And so this resulted in directors and donors being more open to considering the evidence, but also considering the alternatives than they were perhaps pre-pandemic. COVID has been a significant enough disruption to cause reflection amongst both of those stakeholder groups. And so it's feasible to think that it may have created new opportunities to engage with those stakeholders, those actors, and engage them in discussions about transition or about reintegration of children in care. And the study suggests that the conversations about changing the models of care and how to fund those changes must happen in tandem in order for real engagement to occur. One thing that was super interesting about this study was the link with the fundraiser. And so if that person was not the fundraiser, if they didn't have control over the funding mechanism, their capacity to engage in reflecting on consideration of changing the model versus kind of tinkering with aspects of the services was quite severely curtailed. And so it really did appear that if we want to have meaningful conversations about transition, we do need to be engaging in terms of helping them work out how to fund that. So again, these are some of the reflections, and it was a small insight study, so it's certainly not necessarily representative of what's happening in the broader residential care sector, but it's certainly some good food for thought and discussion. And I'll hand back to Britta at this point. Thank you.
Thank you so much, Rebecca and Kate, and certainly a lot of food for thought. And really, for me, I hear, I mean, there are so many, it's a very data-heavy report, and I saw there were some questions in the chat regarding the possibility to get the slides and the recording and the report. You have the information in the chat, but it will be sent to all participants by the end of this week. And we have also, Rebecca and Kate and the team has also developed some short briefing notes, which are much easier to digest. But for me, this is, you know, behind all these numbers and behind all this data, there are so many really kind of the stories behind this, because you are speaking about children who are being sent home without any preparation and any follow-up to isolate together with families they haven't met for a long time. And you're speaking about caregivers being isolated away from their families with their children in care. And you're speaking about orphanage directors who see that actually being away or kind of not having the volunteers in the residential care center is actually good for the children, but at the same time they feel forced to having, you know, inviting them back. So there's a lot going on, at least in my mind. And sometimes a bit hard to get a grip on, but I hope we can do that when we listen to the country level presentation. Gift Kantamane, who done some of or all of the interviews in Thailand, will talk more about the situation in Thailand and some of the reflections you have done through the interviews and the work with the report and the alternative care sector in Thailand. Gift is an advisor for Alternative Care Thailand and a lecturer of Religion and Development Program at the Mahindol University in Bangkok. And if I'm correctly informed, you also completed your PhD last year. Congratulations, well done. And Gift is currently conducting research on children without parental care, and is also drafting policy suggestions on alternative care for Thailand's government. So really well placed both to do the study, but also to work on follow-up with the findings from the study. So really interesting to hear what you're saying. So please.
Thank you very much, Britta. Sawadee ka from Thailand, and I would like to present to you the case of Thailand related to the situation or the report that Rebecca and Kate just presented to you. But before we go to the implications of the report in the country level, let me share with you a little bit about Thailand. And in the next slide, you will see that often people would still, if you're not from Asia, the next slide will show you that Thailand is not Taiwan. And that's always some joke that I always play because many of the times when I presented about Thailand, and people still think it's Taiwan, but I'm glad, and I see a lot of my colleagues from Thailand here, and a lot of my colleagues in Asia, so we know where we are. And next slide, please. Children in Thailand, interestingly, we work on the issue of children, but oftentimes we have to relate that to the situation that Thailand is about to be a complete age society. And in that situation, you'll be surprised whenever we want to propose something about the budget or about the importance of children issues. Sometimes we have to start by saying that we need children to be to have a lot more quality children, so-called, so that they would be able to tolerate and endure when the society become completely aged. So that's a situation where we work here in Thailand. The births declined, and the number of children actually declined every year since 2017. And the next slide, please. But one of the strengths in Thailand is that kinship care is very common. From the mixed data of UNICEF in 2020, we see that almost 1 in 4 children, so about 24–25% of children in Thailand are with their relatives. And the main reason why their parents are not present is because the internal migration. But it's so common that, I mean, I myself am with my grandmother when I was young. So kinship care is almost something that is very cultural here. Very easy to find, very common. And however, the sad thing is that it's not systematically supported. Kinship care is common enough, but because of the lack of systematic support, you will still, in Thailand, we still have only 5,500 families that get financial support monthly from the government. And I mean, you can't compare the scale. It's just out of proportion. 3 million children in kinship care, only 5,500 are supported. And the family-based options about kinship care that I just presented to you, but if you go to foster care, we still have about 400 foster families in Thailand. The things that we try to promote is family support and family strengthening, but it's very scarce and scattered. In a research, in high migration area in Thailand, we asked kinship families about the financial support or any kind of support that they get from the government. And you can see from the red bar on your right, the majority of them said, I haven't had any support from either the government or the NGOs. So this is the situation that kinship care, the majority are grandmothers, maternal grandmother, very cultural. Maternal grandmother are those who care for children. They are in maybe 60, 55 years old and without support from either the government or NGOs. And that's the situation pre-COVID. And next slide, please. So where are other children in alternative care? In Thailand, the system still relies heavily on institutional care. In 2016, when we had, and this is from One Sky, and I'm glad Andy is here with us, and when we had an online survey to see where are the residential care facilities in Thailand, there's no enumeration and no one knows about the real number until 2016. And the methodology that One Sky used is the online tracking and see how many care facilities were mentioned online. And at that time, there were about 400 in 2016, but now it's about 600 private children's homes in Thailand. And half of them are still, we would say, illegal, but to be more compromised in the tonation that we use, we might say they operate outside of the legal system in Thailand. And 63 of them are located in northern Thailand, and you may have heard of the name of the provinces, Chiang Mai, Chiang Rai, and Ta. And if you look at these provinces, you know that there's a strong link between institutional care facilities and missionary works and tourism. And is confirmed by the research as well that 64% of them are affiliated or themselves are faith-based organizations. And even though Thailand has about 1% or less than 1 million Christians in the country, in our country are predominantly Theravada Buddhist in religion, but more than 80% of those 64% that are related or faith-based are Christians. So again, something that's very out of proportion. Christians play a very large and major role in supporting, running, and operating this residential care in Thailand. And of course, needless to say, there were reports of malpractices in those facilities as well. And next slide, please. So those were pre-COVID situation. But when COVID hit Thailand, like anywhere else in the world, the children that are affected or tested positive for COVID-19 is about 65,000 children, including those that are in care facilities, both in public and private residential care facilities. More children are being separated, often poor, starving, and many of them are dropping out. We're actually concerned now about how children cannot cope with online learning, not only because of the fatigue that they have, because they could not afford the iPad or computers to go online, to be online. So there's a lot of children dropping out. And the situation here is worse than when tsunami hit us, because more than 5,000 children have lost a parent in Thailand. So that's the situation. And as from the photos, you can see family separation, you can see children are being treated separately from their parents. But that was the situation during maybe last year or the beginning of this year. We are also concerned about children who are not tested positive, but are also very largely affected by the situation of the pandemic. And next slide, please. What's interesting is that, as you can see, the A, B, and C timeline that I put there, that's the graph of cases, confirmed cases in Thailand. Since 2019 throughout 2020, it's basically very flat. So it's, the society was able to absorb whatever the problems that arise from the pandemic until the last 4 months, which is April 2021. That the number of confirmed cases has increased dramatically. At first, children were separated, but many of the stakeholders tried to confirm and insist that children should be with the family. I mean, UNICEF launched a manual, guidelines in Thai to help and assist other stakeholders, especially the medical staff, to understand the importance of having children be treated while their parents are with them. But once the cases arise, and I'm talking about since April this year to about now, once the number of cases rose to 20,000 cases a day, now all hell break loose. The society no longer able to absorb the problems. Relatives may not be able to care for their nieces or nephews. Even public residential care in Thailand refused to accept new children because they have to wait for 14 days quarantine before new children can be admitted. So the system, COVID had hit the alternative care system in Thailand at our weakest point. I think I can say this on behalf of my colleagues who are listening now as well from Thailand. The system cannot cope with the situation, and we do not have enough available options of foster care. We do not have even enough social service workforce to cope with this situation because it's unprecedented. Next one, please. So is it an emergency? Well, it has been a year or more than a year and a half now. It's not really an emergency per se, but still there's a sense of emergency there. So for alternative care work and our advocacy in terms of policy, I would say it's a tug of war. and I think I used that English word correctly. Care reform, people may argue whether it has started in Thailand or not, but government and NGOs have worked together to try to flip the pyramids, as Rebecca would say, right? Flip the pyramids to make sure that the large amount of children having a welfare system in place, while only a small number of children would have a child protection system, child protection services. So we were working on that before COVID. But once COVID hit, the policy advocacy work has been paused, I would say, and the government budget has been reallocated, not for DI, which I would hope so, but for other COVID responses. So even the international conference that we thought we would have in Thailand last year was postponed, and we hope to have it by next year. So there's a long pause there for alternative care work on care reform in Thailand. And it's a time that we try to highlight the importance of family and the needs for family support, but it seems like the voice is not loud enough. Pre-COVID, average monthly household income was about $148 a month. And that's from a research in a high migration area in Kanchanaburi. It's Thai-Myanmar border. And in the same area where the whole family of about 5 people had to feed on $148 a month. In the same area right next door, residential care facility use or spend money of $153 a month for a child. So this is the data or evidence to emphasize even more that we need to do a lot of reallocation to family support and family strengthening. Unfortunately, because of the cases, we have about 20,000 cases per day, and it's very high for us in Thailand at this point. There's an argument and a stronger voice saying that there's a need of residential care. People are not fully confident that family would be an answer in this situation. And it's very hard to argue back and saying that, but wait a minute, we can still work for solutions that children can be with families, but it's getting harder and harder because even the government units would try at this time to house a lot of children at the same time, and they would have to resort to residential care. I'm sure that my colleagues would agree with me that there's a way for us to make sure that residential care this time would be used very temporarily, but the sense of supporting residential care in the society now is very strong. The pictures that you see now, the 3 pictures are the story, a real life story of 2 children whose mother died of COVID-19. And the last words that she said to her children, to her 2 daughters, were that if I wouldn't make it, you should go to orphanage. So that's the words. And it strikes and it hits the public very hard that a lot of people offer their help to be foster care, to do adoptions. But luckily, the Thai government went in there and solved the situation. And those 2 children are also infected and now in a hospital. But you can see that from this case alone, the public awareness and the lack of family-based options brought us to this point where we really have a harder situation to advocate for alternative care in Thailand. And the last slide, please. So the implications of the findings from the research that Rebecca and Kate have done and analyzed, and thank you for allowing me to be part of that research as well. And the implications for us for care reform in Thailand is that we more than ever need to do DI very, very strategically and effective. We have to introduce a more financially sustainable ways to fundraise. And as Rebecca and Kate mentioned, there's a lot of people now in Thailand, the residential care operators who are in transition, and they're actually more acceptable to change. They're looking for new ways to operate the service that they provide. they're looking for new ways to fundraise. So this is the time where we would introduce to them how to fundraise in a more sustainable way. And being sustainable, I mean, in a way that they can support more families in the community rather than using the amount of money, the same amount of money to support only one child. In this regard, internationally, I appreciate a lot about the work that all of you have done, especially on educating funders in international levels, particularly the faith-based organizations, to understand more of how should they support alternative care in Thailand. We've seen firsthand the situation that a lot of residential care operators will say we no longer have money or fundings for orphanages anymore, and we're looking for new ways to seek more fundings along the line with family strengthening. So I think we work hand in hand in this regard, and I would encourage you wherever you are to work on this regard more because it affects us in Thailand. And we also, one of the residential care operators that I interviewed in Thailand came back to me and said, can you show me how to DI? Can you show me how to transform the care model? So this is the prime time for us to providing the how-to these care facilities who are looking for change, but they just do not, at a very short period of time, know what to do. And we probably have to look into DI models. And I'm glad that my colleague Jane is looking in that regard now. And we hope to have the DI models in Thailand to showcase that it's possible. Thank you.
Thank you so much, Gift. And thank you for also ending on a more, maybe not positive, but at least more optimistic note, because the situation that you're describing is quite grim and disheartening. But really, it just shows how important your work is. So time to introduce our last panelist, not least, who will share some reflection exactly on what Gift ended on talking about, how this data can be used for advocacy towards foreign donors of residential care centers. Is this maybe something that can help us help them fund better care? So Daniel Gleisner is a project manager at ERIK's Development Partners, and in that role, he's advocating within the faith-based community for a transition from institutional care to family-based care. And Daniel has worked with these and similar issues for a very long time, including 5 years in Cambodia, where he worked with family capacity building, and more than 10 years or close to 10 years in Sweden working with unaccompanied minor refugees. So we're really curious to hear more about how we can use these findings in advocacy towards donors, especially faith-based donors, and maybe you already have some experiences of using this data. So welcome, Daniel.
Yeah, thank you very much for the presentation, and thank you for inviting me here as well. It's great to hear, yeah, especially Gift and Rebecca and Kate. It's great and encouraging to hear your voices from wherever you are. And what you say makes it even more important and boosts in the work we are doing for advocating towards a more family-based care. You can please take the next slide, please. I'll just start with a brief background. ERIK's Development Partner has a previous history themselves of supporting residential care institutions among other forms of childcare. But in recent decades, there have been a journey towards a focus on family-based care within the projects, and we have in the last 5 years been more advocating actively in Sweden and around the world as well. And I work in a project called Out of the Ashes into the Fire, where ERIK's partner together with World Childhood Foundation in advocating for and promoting transition of RCIs to family-based care. And my role is, as Britta said, to reach actors and donors within the faith community. Would you please take the next slide? So we had an event, a webinar to draw attention to the report release in May, especially directed towards the Swedish faith-based organizations such as church denominations, congregations, mission organizations, and founders and donors of RCIs, as there are overrepresentations of RCI support from these actors. And as part of the webinar, we had a panel discussion where representatives from ERIK and two of the bigger evangelical denominations discussed in what way the churches can become better in relation to international RCI support. And they found the result of the report very interesting, and the issue of short-term missions and volunteer trips that were discussed among other issues. And this is where the report and its finding become a tool for bringing new arguments to the table. And as the report showed, there are even fewer positive effects of volunteer visits than thought to be. And the main purpose is to raise more funds, as Kate and Rebecca told us before, despite also the damaging effects on the children it has. It's still a long way to go from seeing reforming change of denominational level, but there is an openness for input, which was shown in the panel discussion. And in a sister project to Out of the Ashes at ERIK's, we have worked for 3 years in cooperation with 2 denominations, raising awareness within the churches about the damaging effects of residential care for children. We have seen good results in increased awareness and willingness to cooperate in promoting family-based care. And the report really provides further momentum in this process, where now 4 to 5 of the major denominations wants continuing discussion with ERIK about how to decrease the support for residential care within their organizations. And in reality, it means potentially reaching about 50% of the evangelical churches in Sweden. So we hope that this work continue to have the momentum. The findings connected to volunteer visits in the report is an important issue to address in the advocacy work within the faith-based community, because it's common with short-term mission trips and volunteer trips, and the report provides more strong arguments as to why volunteering at orphanages does not help the children. As research has shown, and as the report indicates, also frequent visits of volunteers damaging both the relations to the caregivers at the RCI, as mentioned before also, and the safety and security of the child. So how do we use this knowledge with the report in the best way possible? Yeah. Since ERIK have strong connections to churches and denominations and mission organizations, we have opportunities to reach many who facilities short-term missions and volunteer visits, such as youth groups, mission boards, and other organizations organizing trips. So even if the report was released recently, it has already been valuable in discussions and meetings with different actors involved in RCI support. And the advocacy arguments have become stronger and more concrete of how the visits of orphanages worsen the situation for the children. And another important indicator from the report is that there is still a unique window of opportunity for change, as both Rebecca and Kate and Gift mentioned before as well. As there has been major structural changes for many RCIs during the pandemic. So the founders and directors are more open for reflection and for change. And as in these cases, when children have been sent home due to the national restrictions, RCI directors and founders have been updated of the family situations of the children and seen that in some cases there are opportunities for children to be reintegrated in the families. And these insights from the report gives new incentives in advocating for family reunion as well. And especially the approach of seeing maybe partial change for some children can create openings for more change further down the line. Like if it works for these children, it might work for others, so to speak. And this approach has worked as an opening for change in relation to founders, from our experience. As the report showed, there is a significance in reaching and influencing the founders and fundraisers in particular to see a change in the residential care. And this has been confirmed through the work in the joint project of ERIK and Childhood, where the advocacy work has seen more openness towards change when founders and fundraisers of orphanages has been reached directly. And often founders and fundraisers has been the same person in these cases. Our experience is also that founders generally have reached further in their mental process towards change compared to financially supporting churches and mission boards, as founders often have a more frequent contact directly with orphanage directors, workers, and children. It might not always work in favor in these cases, but what we have seen in these few cases, it's been positive. Next slide, please. So as mentioned before, there are some strategic decisions that are important to take. The importance of reaching the founders and fundraisers is crucial for transitional effects, but that does not exclude the importance of raising awareness within denominations about the effects of RCI volunteer visits and the general damaging effects of institutional care for children. And this is more a long-term work where the effects will hopefully be better choices in the future of what kind of projects churches will support in the common goal of empowering children for a better future. There are also structural strategies to consider when to effectively reach the faith community. The issue of visiting orphanages or residential care can be too narrow of an issue from our experience sometimes, especially in relation to denominations. It means that the issue sometimes needs to be packaged together with bigger issues such as mission policies or child rights approach or something similar. It's a balance where you need to decide if the issue risks to disappear among others, or if it can benefit by being part of a wider concept. And to summarize the work of advocating for family-based care over institutional care, we must both be working directly with the actors involved in the transitional work, in these cases, mostly fundraisers maybe, and at the same time be working long-term to see a shift in funding towards a more family-centered care within the faith-based community. And a possible approach in this context could be, as I mentioned also, to promote smaller changes first, which hopefully leads to the desired transitional changes in the future. That was all I had. Thank you. Back to you, Britta.
Thank you so much, Daniel. And then I would like to ask all the panelists to switch on your camera and microphone, or at least camera to start with. Thank you, and Daniel, you too. Yes, perfect. And so I will ask some questions, but everybody attending is, welcome to write a question in the Q&A chat, Q&A function. I see there is one question. We will ask that question, but I will start with another one. First, I will start with you, Rebecca and Kate. Maybe first Rebecca and then Kate. If you can share what was the most unexpected or most hopeful finding from this study? And if you can share some reflections around what significance would that potentially have for the future work. So Rebecca.
Yeah, so I think for me, it was the link to the fundraiser. I think in the past, I'd always thought about it as orphanage directors or donors and the strategies you employ to go after a director or go after an orphan or a donor to engage them in the change. And the understanding that actually the direct connection to the fundraising role was actually perhaps more significant because it allowed them to straddle both sides to consider how they could connect new strategies for fundraising to a strategy for changing the model of care. And I hadn't necessarily thought about that or understood that connection before. And I think that's really hopeful because it gives us a little bit more of a sharper target to understand how we move this forward, how we progress the conversation. But it also helps us to realize that sometimes the resistance we might face may not actually be an unwillingness to consider transition. It may actually be that we haven't created that legitimate space for consideration because we haven't connected the funding strategy to the conversation about transition. And so we're perceiving it as resistance, but perhaps it's not always the case, which means there might be greater capacity to really further this conversation also with orphanage directors, which I think is really hopeful.
Thank you. Kate.
I think the most hopeful finding for me was the strength of pre-existing government intervention, and that was the greatest determinant in successful reintegration. Because I think for a lot of us that have been advocating for years and working at that systems level and really working with governments to try, and I know many of you on the call do exactly that work, I think it's really encouraging to see that labour has really borne fruit in this situation, and that when reintegration was undertaken and there were those pre-existing mechanisms where governments have been working towards reintegration, working towards deinstitutionalisation, that was when it was most successful. And when that wasn't in place, that's when reintegration was really patchy and more unsuccessful. So I think that's a really positive message for advocates. It's a really positive message for people working at that systemic level. So that was really hopeful, I think.
Thank you. And Gift, if was there something in particular that surprised you when you did the interviews in terms of how the directors of RCIs in Thailand kind of reflected on the situation and had managed the pandemic?
Because the situation has changed a lot from when I interviewed them till now, and it's get a lot worse. But what surprised me when I did the interviews was that they're not looking to forever operate an orphanage. So they're actually looking and seeking new ways to change the model, and as the research shows, maybe not change the model, but at least change the way they do things. So they're quite susceptible to change, and it's a prime time for us to actually intervene now. They're more than ever. So that's surprising for me. They're not stubborn as we thought they would, but no, they're not.
That's good. That's really, really encouraging. Daniel, would you agree, or is there anything else that surprised you or that you feel is particularly hopeful or helpful?
Well, I think for me it's a lot of stronger arguments is being given in the advocacy work, and especially maybe connected to the volunteering. When you hear the actual voices of directors and the founders and fundraisers saying that it has negative effects, and that it's basically mainly for financial purposes. So that could also be a very strong argument. Then, of course, it's very positive to hear the openings of change that both you, Gift, and Rebecca express as well, and it's really encouraging to hear that. Yeah, this is something that we can do. We can go forward from this, even if pandemics in itself is tragic, but there are openings for people in need in this case anyway.
Thank you. We have a question. Sorry, we have a question from the audience, from Andomalak Takele, if I pronounce that right, from Ethiopia, asking if there is any funding agency to replicate the study in Ethiopia, because they would love to do the study in Ethiopia. And I don't know if you have any comments on that, but maybe if we widen the question and do you feel that the data we have now with this kind of relatively small qualitative study, is this enough to build the argument we need, and to understand how COVID has affected privately run residential care institutions, or do we need more data? Or could this kind of study and data be used also, for example, in Ethiopia? Rebecca, do you want to start?
Sure. It's a small study, so I definitely think more research would be really valuable. We also need to recognise that when we did this study, the pandemic wasn't over, and in fact, in many countries, it's escalated. And so we don't necessarily yet have a full understanding of how COVID has impacted these institutions, even in a small number of institutions per se. So I think there's incredible value in replicating the study in other countries and expanding it, and in continuing to do follow-up and see whether it does reflect the same sorts of issues that are coming up in other countries at this point in the pandemic, but also whether there are regional or cultural differences too that would affect the types of strategies we would employ, and help us understand how we change them and why we need to change them for specific contexts.
Thank you. And I think that the alternative care platform is exactly meant to be the platform for that kind of exchange, right? So I do encourage all of you to also continue to ask that questions, and maybe reach out to you who did the study for to learn from the concept and the questions and the methodology. But I would like to move on, because you also referred to how the situation has deteriorated in many of the countries, maybe all of the countries where the study was carried out. And we just recently, there was a new study published in the Lancet talking about over 1 million of children being kind of orphaned due to the pandemic. And we do see, how the prolonged restrictions in many of the countries are continuing to affect children and residential care institutions. And Gift, you have already touched upon that, but could you, what do we know about this? I mean, a very broad question. I do think we need to say something about that. So Gift, if you could say a few words, and then maybe Kate, if you can mention if we know anything about some of the other countries where the study was carried out.
In Thailand, the situation, as you said, is getting worse. But one of the other things that is interesting from this research is that we thought that the fundings would be less coming into the country because there's no volunteers, international tourism, there's no international volunteers, there's no connections as it used to be, very close connection between the operators and the funders. But it seems that once the COVID situation is getting worse, we tend to hear more of the new orphanages opening up, new branches of orphanages opening up in Thailand. So that's another surprising thing. And it probably not only people in Thailand would have to work on this, but all of us in a global level, because it's two-way projects and we need to apply pressures on both sides. But another worrying thing, not of COVID situation is getting worse, but also alternative care in Thailand, the situation is concerning as well. Yeah.
Thank you. Kate?
Yes, look, I think that we've all been waiting for this to happen because it's very well known. And, actually, Rebecca and I have a paper coming out on this next week that after any form of kind of natural disaster or medical disaster, that orphanages proliferate as a aid-driven response. And I think that with COVID, you know, obviously this is quite a different experience than we've had before, but I think we've all been kind of holding our breath to see there's going to be children who are orphaned. This is definitely an opportunity in which orphanages would normally proliferate. Will it happen? And how can it happen without this, you know, rush of Western volunteers coming in? So we don't see the Western volunteers perhaps coming in, but we're certainly seeing the funding start to come in, I'd say. And the other thing we're seeing is the opportunism that drives that starting to pop up, I think. And I don't think that's not particular to Thailand. I think that is going to be very widespread. And certainly I'm seeing evidence of it. There's been a lot of media on it in India, which wasn't one of our countries of study, but there is a lot of media on it at the moment there. There's been talk of it in Nepal, and certainly Rebecca will be able to speak about Cambodia and that context. But, you know, this is something that we expect. I think we were hoping, that the systems were strengthened enough that we wouldn't see it, you know, that we were kind of crossing our fingers, and B, that the intervention of this pandemic, it was unlike anything we'd seen before in terms of cutting off travel and cutting off aid and those sorts of things. And everyone's in the same boat, whether you're in one of these countries or in one of the funding countries. So, you know, is everyone just going to concentrate on their own boat and paddle like mad, or are they still going to reach out and try and help others? I think we've got to the point in the pandemic where that reaching out is starting to happen again, and it's driven by this opportunism. Beck, do you want to say something more on that?
Yeah, just quickly in regards to Cambodia and Myanmar, one dynamic that's being raised in Cambodia is that in many cases, RCIs that have been engaged in the process of working towards the government's action plan on reducing the number of children in care by 30%. One dynamic we see a lot here is that not many of those institutions are actually looking at fully transitioning. They've been reintegrating, but without actually a structural plan to transition in terms of actually enacting a change of model. And so we've seen a reduced number of children in those institutions, but now it appears like because the institutions are still there, they're still open, they're still essentially providing the same type of service. Now there's a concern about new children coming in, despite there having been a freeze on new children coming into those institutions for quite a long period of time. So there's a concern now about the dynamic of, yes, there's been a reduction, but because the model of change hasn't happened, the change of the model, hasn't happened, they're still vulnerable to having an influx of new children. In Myanmar, you've got this really radically different dynamic where you've got a political coup and a pandemic coinciding, and there has been quite significant rapid reunification of children out of institutions, focusing a lot on children who are in institutions in political hotspots in parts of Yangon or other parts of the country, where there's now a real concern, and has been for the last few months, about the inability to really protect those kids or provide for them with all of the growing restrictions and concerns coming in. And so there's been more rapid reunification there, and institutions that in the past were really closed to transition and reintegration, all of a sudden coming back to particularly connecting Myanmar's team and asking for assistance to reintegrate those children rapidly now because of those dynamics. So we're still seeing some differences across some of the country, but we're certainly seeing an evolution of patterns, you know, based on the different triggers and stimulus that's happening.
Thank you. And we also got a comment in the chat from Florence saying that in India, we're seeing something similar with temporary shelters being started to take in COVID orphans. Actually, this is the first time I hear this term, probably you have already. And it's a big question on how temporary they will be. So we have a couple of minutes left, not much. And I would like to ask all of the panelists to give us all your best argument, maybe based on the findings from the report or your kind of really, you know, broad experience. But I think, you know, we have talked about that in different ways, how we're struggling with arguments towards donors, residential care directors, fundraisers, maybe volunteers, you know, civil society organizations. So pick one kind of target audience and give us the best argument. Daniel, you started to talk about, you know, you have really struggled and tested a lot of different arguments towards the civil or the faith-based sector. So, and you already talked about how important it is to broaden the narrative and place it within a broader kind of sustainability or something. Maybe you can start with giving us the best arguments now when this potential new influx of COVID orphans are coming and people want to start new orphanages or shelters.
Yeah, now I think actually, well, maybe I start just with the faith-based community that is.
Yeah, you take you have 1 minute each.
Okay, that is already
half a minute each.
Part of the residential care support, because I think just the pandemic, to talk about the pandemic and what has happened during the pandemic is a great opening, actually, because there's been so much change all over the world. So, and then you have the report also to support your arguments. It's really been great when reaching out to directly to founders and fundraisers to start there. What has happened in your context with your orphanage, and what can we see? What can you see of changes within the next year or two? And that's been really good and been a great help, actually.
Thank you. Gift, what's your best argument? The one or two sentence argument.
Without international fundings, number of orphanages in Thailand would be half immediately. So I think we appreciate a collective platform like this to work together, apply pressures from both sides, and I hope in my lifetime Thailand would have a proper alternative care system.
Thank you. Kate?
I think mine is that systemic change matters. It matters at a governmental level. I think often we're really concentrated on working top down, bottom up. We've got to remember that both of those really matter, you know, and that critical moment of realizing, I think, and being able to say to governments, what you do here actually has really practical positive effects is a really positive step forward. It's a really great tool for us moving forward, I think.
Thank you. And Rebecca?
My argument would be that orphanage tourism is never about children. It is never for the children. It is for the volunteer. And we saw in the study that even those participants who recognised that children had done so much better without having the volunteers all still said they had every intention of resuming the practice, knowing full well it was not in children's best interests. So the argument of, but what will happen to the children's care if I don't volunteer, is not a valid argument. It's not about the children.
Thank you. And thank you all of you who attended. Thank you all the panelists. There has been a lot of information and a lot of data and numbers in this webinar. The report is available online on the platform. Can we get the final slides where we get to see where the yes, exactly, where you can download the resources, the report, short briefing notes that are really helpful also with the arguments. The full report, so please share and use and share with the rest of us how it works out. And I would like to end with a quote from one of the orphanage directors from the report, who said that we learned that his family is possible, even in the worst situation, whereas before we thought it was impossible. So it is possible, and we're all working for that. So thank you so much, and continue with that work. Thank you all.